Hi, my name is Asim Ansari. My father was admitted in Yashoda, High-Tech City almost 1 month ago. He had a very serious heart condition and lungs disorder as well. Consulted Dr. Purohit firstly. He was our previous very old doctor. I mean, he's been looking for my father since years now. He said that surgery is compulsory right now. He referred us to Dr. Vikram Reddy.
Yeah.
Surgery went well, but of course there were post-surgery complications. A lot of post-surgery complications were there. We were very worried because he was in a very critical stage. He had multiple issues. I cannot mention each and every issue. Sincere, dedicated, compassionate, personalized care was given by the hospital, especially by the nurses. Most importantly, firstly, I would like to say Dr. Vikram Reddy, he is a man with golden hands. He has worked 24/7 on my father, worked personalized. He gave, like he is the only patient in the hospital that he is treating.
And the counseling also was...
The counseling also was done timely. They tried to comfort us at least 2 to 3 times a day.
Yeah.
Dr. Venkat, the critical care head, Dr. Siddharth, Dr. Nikhilesh, every doctor, I'm sorry if I'm missing any names, care doctors, the nurses, the cardiologist, Dr. Bharat Purohit, the surgeon, most importantly, Dr. Vikram Reddy, everyone gave us personalized care. We are really happy after 1 month now today. We can say that our patient is back to normal. We are happy with the services. Especially regarding the nursing staff, we would like to say since last 1 month, he was on bed, but not a single bed sore. That shows us the quality of nursing that they have done. That's it. Thanks a lot. Yashoda Hospital, High-Tech City.
Thank you to the doctors, especially Vikram Reddy. Again, I want to mention Dr. Purohit and
Dr. Venkat Reddy as well. Every doctor, but firstly, top of the chart is Dr. Vikram Reddy.
And also the nurses did a fantastic job, in the ICU and also upstairs and everybody. So we're happy. We're happy. Thank you so much. Thank you.
Thank you. Thanks a lot.
I'm Dr. Vikram Era. I'm a senior cardiac surgeon at Yashoda Hospital, High-Tech City, Hyderabad. I present to a case, Sir Azim Ansari, a 68-year-old gentleman from Hyderabad. He presented with severe LV dysfunction, ejection fraction of 28% and severe triple vessel disease. He had stenting done in 2019 where multiple stents were put in. All these stents were blocked this time and his heart function was extremely weak. He was a heavy smoker and smoking until recent prior to his admission. So his lungs were pretty bad shape and he was admitted for congestive heart failure. So he was stabilized and then angiogram was done which showed severe triple vessel disease with complete blockages of the previous stents. So, and there was leak in mitral valve as well. So we counseled the patient and his relatives for high risk bypass surgery. The high risk in his case was because of his severe depression in his heart function. Ejection fraction was just around 20-25%. Heart was very dilated. So relatives, they agreed and patient agreed. We went ahead and did 4 bypass grafts with IVP support, which is called intra-aortic balloon pump. Post-operatively, he made a very slow progress, which was quite expected. He also had multiple episodes of rhythm disturbances for which he received cardioversion and medication. And he also had a tracheostomy to manage his lungs. He made a gradual but steady progress and he was discharged a month later in a very stable condition. His heart function improved to 35% to 40% and he's under follow-up. I saw him 2 times in the outpatient clinic and he's able to walk now and he's doing extremely well. I'm glad with his progress and thank you.